Suicidality among Black youth is a growing public health crisis in America. It is defined as one's risk of suicide presenting as suicidal ideation or intent. It is associated with a well-thought-out plan, but can include passing thoughts and feelings of suicide. Suicide is the second leading cause of death among adolescents, and 9.8% of Black youth have experienced a suicide attempt in the past 12 months. This is the highest rate among all racial and ethnic groups in America. The suicide rate for Black youth grew 144% between 2007 and 2020. Black Americans make up 13% of America's population, but a significant portion of those in poverty. Poverty is a significant risk factor for suicidality, and 38% of Black adolescents are in poverty. Black Americans are also more likely to avoid seeking help in healthcare due to lack of cultural sensitivity and understanding. Concerning poverty, poverty is associated with increased stress, suicidal ideation, and lower healthcare use. Cultural differences and stigma also prevent Black youth from seeking care in times of distress. It is important to note that discrimination and inequity can cause race-based stress, suicidal ideation, and destructive behavior among Black youth. Those who experience discrimination are more likely to report experiencing suicidal ideation. Yet, despite facing various forms of systemic and social oppression, Black youth are resilient. Afrocultural values and collective identity in the Black community have been shown to promote well-being, improve self-esteem, and lower rates of depression. Closely identifying with their race is a protective factor against suicide among Black youth. It improves their self-esteem and their sense of control over their lives. For some potential interventions, those implemented with peers, such as the Youth Aware of Mental Health program and the Adaptive Coping with Stress course, were helpful in reducing suicidality among Black adolescents. They have helped reduce stigma around mental health care and promoted help-seeking behavior. Additionally, programs that teach coping skills such as art programs and hip-hop therapy have been valuable in giving Black youth an outlet to express their emotions. They have led to improved mental health outcomes and reduced suicidality among this population. Future interventions must create culturally responsive mental health treatments that will make Black youth more comfortable to seek help when facing a crisis. They must involve their cultural values, and it is recommended that these options are easily and readily available to them. They must be low cost and address the feelings of shame and stigma that they face. For long-lasting interventions, these treatments must address the social, economic, and systemic barriers that cause stress among this community. Cultural sensitivity is crucial for their effectiveness in understanding the factors that contribute to Black adolescent suicidality. In conclusion, the Black youth suicide crisis is a growing public health concern that can only be addressed with cultural sensitivity and patience. Suicide is a layered and complex issue. It is not simple, and we all need to work together.